Hello and welcome. I'm Kamran, Abbasi, Editor-in-Chief of the BMJ, and today I'm delighted to welcome our special guests talking about a very, very important topic, and it's in relation to a conference that was held a month ago at PMAC 2022, and the title of this collection of articles is "The World We Want: Actions Towards a Sustainable, Fairer and Healthier Society." Now, in the middle of the pandemic, I think we all thought that this is exactly where the world was heading towards: a fairer, more sustainable, more equitable society. And in all honesty, I'm a little worried about that as to whether those hopes are floundering. So I think it's very, very important, certainly, especially with the ongoing conflict and war in Ukraine, to think about, what is the world we want and how do we get there? And to help us talk about that, I'm genuinely delighted to say we have Fran Baum, who's Professor and Director of Health Equity at the Stretton Institute, University of Adelaide, and co-chair of the Global Steering Council of the People's Health Movement. We have Ronald Labonte, Professor and holder of the Distinguished Research Chair in Contemporary Globalization and Health Equity at the University of Ottawa in Canada. We have Kent Buse, Director of the Global Healthier Societies Programme at the George Institute for Global Health. Maria Nielsen, who's Professor of Public Health at the Department of Epidemiology and Global Health at Umeå University, Sweden. And Ankana Legukul, who's a researcher at the International Health Policy Programme in the Office of the Permanent Secretary in the Ministry of Public Health, Thailand. So welcome to all of you. I'm delighted you're here to talk about the world we want, because the world we want, I think, is the world we need. And I want to understand how we get there. Now, it's really excellent that we have a very good number of participants joining us as well. If you have questions for us, which we will take, we're going to have a healthy Q&A session. Please leave your questions in the Q&A box that you'll find on your screens. And we will have, the running order is that we will have talks from each of our speakers and authors, followed by a brief Q&A amongst the panelists, then an open Q&A with everybody who's joined us today to listen to this webinar. So without further ado, and I think in advance, I'm going to make an early start and move to Fran to start us off.
Thanks very much, Cameron. I'm just sharing my screen. And there we go. So this is a big question about the world we want following the pandemic. And the paper that myself and my group have asked the question of, well, what's the impact of COVID-19 on the chances of the world achieving the Sustainable Development Goals? And as Cameron said, maybe about 9 months into the pandemic, governments were doing things they hadn't done before, and it seemed that maybe that would be happening. But as we looked at each of those Ps, starting off with the planet, we know that there's dangerous global warming has continued, even though carbon emissions dropped in 2020. They've gone up to their highest level ever in 21. We absolutely need rapid transformative change. We have worse floods. People are talking about 1,000-year floods in Australia at the moment. While COVID showed that governments can pivot quickly, it seems that climate change is just not getting the same response as COVID-19. And one of the things we argue in our article is that we need to learn much more sustainable relationships with nature from Indigenous communities. In terms of people, there are now, following the pandemic, there are more people in extreme poverty, and there really needs to be a much greater recognition that poverty is a political choice. It's something that happens because of how we decide to distribute things, and there's certainly enough wealth in our world to meet everyone's needs for education, health, fair employment, and the other things that make for a good life. But unfortunately, our resources are not distributed equally enough. Which really leads us on to the next point about prosperity. And we've seen in the pandemic that wealth inequalities grew. In fact, in 2020, it was the steepest increase in billionaires' shares of wealth in the world. And much of that wealth is because people who had capital were able to speculate on COVID-19 products and make a lot of money. And our conclusion is that we really need to rethink the whole idea of GDP and think about new economics. How can we have an economics that is people-centered, not profit-centered? And unless we do that, it's very unlikely that the SDGs are going to be met in what is now only 8 years away. And peace, justice, and strong institutions. When we started writing this paper, of course, peace, though there are lots of wars and occupations across the globe, I think everybody's been so shocked by what's been happening in the Ukraine, and just seeing the sort of disregard for human rights has really just highlighted how much you cannot achieve SDGs if you've got war. During the pandemic, refugees met closed borders and their situation became much worse because they were less likely to be resettled. And perhaps most worryingly, the pandemic has provided a cover for clawing back of many civil liberties. There's been real evidence of crackdowns on civil societies and journalists in many countries. And rather than bringing a sort of flourishing of civil society and responsiveness to civil society, there's instead been a reactionary move, I guess, against civil society in so many countries around the world. And in the People's Health Movement, we hear that particularly from India, the Philippines, Brazil, Nicaragua, and other countries where being an activist has become dangerous, not just something that restricting your freedom to speak, but it's actually can threaten your life. And that really does, I think, challenge the SDGs and whether they're likely to be achieved when there isn't that pressure from civil society able to argue for the sort of basic conditions that are going to see them realised. And then, of course, partnerships sort of underpins all the SDGs. And we've seen the real failure of CTAP and COVAX to ensure vaccine equity. And it really, the case of vaccine equity really reflects the power imbalances in the world. And our argument, of course, is that the SDGs are much more likely to be met in a world where there is much greater equitable distribution of power. We've seen that perhaps in the World Health Organization, where it simply doesn't have enough finances from public finances from around the world to do its job as well as it should. And that's a real worry, because WHO has the potential to be the real leader in global health, but they're not being, WHO isn't really being empowered by the countries around the world, and that really does need to change. And of course, we need public good partnerships, and they really need to be free of conflicts of interest. And we point to the way that food companies can dictate national nutrition policies, and the ways in which those kind of conflicts of interest need to be removed from the policy table, both nationally and internationally. So overall, we've concluded that COVID-19 has impeded the achievements of the social development goals, and that we really need a radical rethink of the global economy and the power balance in the world to meet them. And that's not a very positive picture, but I think we have to look at that situation in order to have any hope, because till we've done the analysis, we can't be optimistic and hopeful. So thank you very much.
Fran, thank you very much. That's very important issues you tackle there. Can I ask you it's a rather big question I'm going to ask you. I mean, I would agree with your analysis. The question really is, how do we move towards addressing those major issues that you've addressed? I mean, I think what you're really arguing for is that we need a world and a society that is governed by a different set of rules, that has different priorities. And that's a major shift. How do we begin to get from where we are now to where we want to get to?
Yeah, well, I mean, the first thing to say is that every big social movement has seemed impossible, before it was done, whether that's slavery, women's lib. So, I mean, I think that's the same with this. the situation we're in as the world. And most fundamentally, I think there are two things. One is to change the way we assess the economy so that we put the emphasis on people. We develop economic systems that are much more distributed, are more local, are actually more in touch with people's needs. And that's the other bit, enabling a system where people can express those needs in a democratic way and in a participatory way, rather than often, a lot of participation can be in name, but it's not really realized in a true sense of people being able to have their voice heard. So I think, those two go together, because I think if you talk with people, then they're very quickly at the grassroots are going to name those things, that they do want a fairer society. They do want businesses to take account of human rights and take account of people's needs. But unless we can move towards that, then it probably is a fairly revolutionary change compared with the situation in the world at the moment. But the sort of geopolitical tensions are so great that's really making it difficult for us to change towards a more democratically governed societies in which we can ask questions about the role of large corporations, the role of business, and encourage governments to use regulatory forces in order to control those activities, to restrict them so that the public good is much more to the fore. So yes, I know it does seem pretty impossible at this point, but every big social change has seemed impossible. So I think that means we just have to note that it's impossible, but try and make it possible.
Well, not impossible. It's kind of very hard to achieve. I think that's what you're saying. Fran, thank you. We'll come back and explore some of these issues in greater depth as we go. I think I forgot to say at the beginning of this that we've got a collection of articles by these great authors on bmj.com, and you can find them on the BMJ's website. I'll even give you the URL. The URL is bmj.com /PMAC 2022, and it makes really excellent reading. So the next author that we're going to speak with is Kent Buse. Kent, are you there? We can't hear you at the moment, Kent, but I can see your slide.
See the slides?
We can see your slides and we can now hear you. Over to you, Kent.
Okay. Well, first of all, I wanted to thank the BMJ. Second slide to recognize.
Can just say, I think we lost you right at the beginning, so you might want to just start again. Sorry about that.
Kamran, why don't you jump to someone else and I'll reconnect on the Wi-Fi.
Okay, we'll do that. We'll absolutely do that. Okay, we will go to Ron Labonte. Ron, are you ready for action?
I guess I am.
You haven't got slides, I know that. So I know.
No. I just got some talking notes here, and about the article that I wrote, and it's actually a nice follow-on in many ways from
yes,
what Fran had to say,
that.
and it's almost kind of in some respects it's a repetition, but from a slightly different angle, because my contribution was really to explore options for a health-promoting and environmentally sustainable post-pandemic global economy. So it was try to review a range of different discussions that were taking place early on in the pandemic. So I began by describing the World Economic Forum's Great Reset proposal, and that would have all of us become stakeholders in capitalism. Now, while critical of the short-term shareholder capitalism of the past half-century, the stakeholder model would essentially reset the economy more or less as it was, with little change in how its underlying reliance on constant growth and capital accumulation was already imperiling global health. Now, government-centered recovery plans, they also proliferated with promises to build back better. Obviously, of course, the slogan of the US Biden administration's originally $3.5 trillion 10-year plan, subsequently scaled back thanks to right-wing Republicans and the lobbying power of the fossil fuel industry. Now, the EU's multi-trillion next generation recovery fund similarly promises a green recovery and emphasizes the circular economy in which there's no longer waste and instead a continuous recirculation of post-consumer materials. So far, so good. If such plans aren't held hostage by fiscal hawks who are now beating the inflation drum and keen to see the pandemic spending of governments reined in with new austerity measures invariably damaging to health. Now, others argue that governments should actually lead much more strongly in mobilizing public and private partners to achieve important economic, social, environmental, goal-oriented missions, which is a rather neo-Keynesian idea advanced by Mariana Mazzucato amongst many other economists. Now, Mazzucato also chairs the WHO's recently established Council on the Economics of Health for All, and in their first policy brief, they outlined a different approach to health innovation than the flawed government responses to COVID-19 vaccines that led to pharmaceutical profiteering and gross inequities in access. The Council simply argues that governments need to put stringent conditions on companies that benefit in any way from public spending and infrastructure. And in the case of vaccines, this could have required technology sharing by companies whose research and manufacture were largely financed by public funds. The WHO Council also looks favorably on modern monetary theory, or MMT, which argues that governments with their own sovereign currency can never effectively run out of money. They simply issue bonds to be held by their central banks. Now, many did this when bailing out banks after the 2008 financial crisis and did the same in response to the pandemic, but there are some concerns. One is that most developing countries lack a sovereign reserve currency and have to borrow from private financial markets, and that makes them very vulnerable to financial volatility. And we're already in the midst of another global debt crisis. And in a still liberalized and largely unregulated global financial system, the $13 trillion in MMT-inspired quantitative easing that high-income countries used to keep their economies and people afloat during the pandemic eventually wound up in the hands of private banks and speculative investors. And that's one of the reasons billionaires grew so fabulously richer during the pandemic and why we're now confronting inflation. So strong regulation of financial markets, targeted taxation to reduce inflation and speculative investments, and measures to restrain monopoly profiteering, they're all companion policies in a potential MMT-based Build Back Better economy. But then we're still left with capitalism's requirement of endless growth and rising levels of consumption, however green or recirculated that consumption might be. And so terms such as degrowth and post-growth have slowly entered policy discourse. And that calls for a democratically led downscaling of material-based production and consumption worldwide. Many in poorer nations will still need more, while those in wealthier nations can make do with considerably less. And such an equitable reduction in consumption in humanities by humanity's wealthiest 10% is essential to create the space needed for growth in countries where livelihoods need to rise if people are to sustain good health or achieve reasonable life expectancies. So in sum, this mission economy arguments could be a base from which we might imagine and then enact a new vision for governments in which they become more interested in promoting the health of their citizens, the sustainability of our planet, than in the metrics of GDP growth, a point that Fran already raised. And if countries band together to do this, it could lead to an economic transformation so dramatic that we might no longer refer to it as capitalism. I'm not sure what we might call it, though the French economist Thomas Piketty likes to describe it as participatory socialism. Whatever name it acquires, it cannot be the capitalism of the past. And to reiterate or reinforce a point that Fran made, in moving towards whatever this future needs to be, we really have to work to protect the space for social movement activism to hold governments to account. Otherwise, we are perilously close to a decline into life-threatening autocracy. So a little bit of a pessimistic reminder that of the kind of the challenges that we're facing. Thank you.
Ron, thank you very much. In a very decent way, you said something quite radical. Yeah, I think what you're really arguing for is this radical change in society, one that moves away from GDP growth and actually values degrowth and lower consumption, as you describe it in your article. Now, the few gathered here might say, yes, we all agree with this. This sounds good. This is a kind of the formula to create a better world. But is there enough traction around this idea and around this thinking that it might have some legs?
I think the traction is growing. One of the kind of issues about the idea behind it, that the term degrowth does not really kind of, shall we say, market well.
No,
neither
does
low and middle income countries.
Yeah.
But the basic argument that on purely empirical basis, if we don't reduce the amount of material consumption that we have, then we're basically doomed on the planet. And we're killing ourselves, full stop. Now, that means a radical redistribution in access to environmental resources, which implies a radical redistribution in financial resources. And that cannot be accomplished under an economic system built upon continuous levels and upward spirals of consumption. Now, in some of the developing countries, what you have is concepts like buen vivir or other kind of notions. Fran touched on those in terms of indigenous ways of relating to nature. You have a lot of activism around extractivism and extractivist economies. So there are points around the world that can be linked into these particular ideas. And if I wanted to sort of say pessimistically, optimistically, kind of a bit of a paradox, is that the kind of the rise of autocratic regimes, the climate crises that gets worse and worse and worse with almost each passing moment, are such that it's going to precipitate some sort of a devolution or crises moments in which it will become impossible for governments or societies not to transform. I mean, so in that sense, I'm almost saying the pessimism of my forecast of what's coming in the near future is an optimism that is going to force transitions, whether the elite or the privileged want to see them or not.
Yeah. Okay. I mean, it's hard to imagine what crises could be greater than the ones we're living through at the moment. But I take your point, and I think, well, let's hope that there is optimism in that pessimism. Ron, I'm going to move us on, and we'll come back to you.
Ankana,
I'm going to go to you now. Ken, I think we'll save you till the end. That's okay. I'm going to go to Ankana now.
Yeah, I'm sharing my slide now.
Yes, please. Over to you. Yeah.
Yeah. Okay, good morning, good afternoon, good evening, everyone, and thank you for having me here. It's my honor to be a part of this event. I would like to highlight some point in the paper, Resilience and Equitable Recovery from the COVID-19 pandemic, which is a part of this BMJ and PMAC 2022 collection. I'm a representative of three others, Dr. Viroj Tangcharoensathien from IHPP and Dr. Dennis Farrow from Global Veron Project. And this article echoed the statement that the emergence and the impact of COVID-19 have been driven by the interactions of multiple determinants, such as ecology, socioeconomic status, inequities, politics. And this is why how we should consider COVID-19 to be a syndemic rather than a pandemic. And we highlighted the key evidence from country experiences to COVID-19. It has uncovered deeply rooted social inequity and brought racial injustice to the forefront of public health and political attention. And several studies have shown that any minority population had a greater risk of COVID-19 infection and mortality. And this pandemic is further complicated by man-made disaster. Politicizing and ignoring signs hamper the rollout of timely and effective control measures. And in addition, hate speech has triggered anti-Asian racism, resulting in an increased level of post-traumatic stress disorder among Asian and Asian American young adults. And in this article, we propose 3 solutions to resilience and equitable recovery. First, roll out COVID-19 vaccination to at least 70% of the world's population by this year. And this is current hampered by the global inequity in access to COVID vaccine. As of January 2022, I mean this year, only 14% of population in Africa had received at least one COVID vaccine, compared with 77% in high and upper level income countries. And the prolonged pandemic in low-income countries will allow the emergence of new variants and spread across the world, due to international travel, and continued research and developments of new vaccine effective for new variants are critical measures. And second, minimize the various determinants which worsen the consequences of COVID-19 on marginalized and underserved population. It's required bold leadership across various governments in support structural reform, which addresses inequities, universal social protections, housing, labor, and employment policies. And universal health coverage ensures equitable access by all the healthcare services, either in normal or emergency situations. And third, strengthen health system capacity in terms of preparedness for future epidemics or pandemics. We need to establish the active surveillance of coronavirus and other high-impact viral families, including influenza, virovirus or flavivirus in bats and other wildlife. And we must strengthen our diagnostic capacity to detect, sequence, and share genomes, which strengthen global preparedness and alert. And we must invest in our health workforce capacity, notably epidemiologists, public health officers, to respond to the outbreak, as well as the frontline clinicians. These are the highlights from our article. Thank you.
Angela, thank you very much. In your experience in Thailand, what was the most effective government level intervention to try to address some of these problems with inequity?
Actually, Thailand, we achieved universal coverage for many years. And I think all people in Thailand, not only Thai people, I mean migrants, workers, they got the tested for COVID-19 and also diagnosed for COVID-19 and also vaccination for COVID-19 for free.
Okay.
And I think it's, sorry, yeah,
yes,
you can continue.
Yeah, do carry on, yeah.
I think it's like an effective intervention to cover all health coverage, not only for treatment, it's also diagnostic intervention.
Okay, thank you. That's really helpful. So you're saying because you had universal health coverage, that helped you address some of the challenges that other countries have had. Okay, thank you. I'm sure we'll discuss this again. I'm going to move to our next speaker, Maria Nielsen.
Hi, nice to be here today with you.
Welcome,
yeah, I'm not having any slides today either. I do like run and just speak. And in our paper that we had authors from an interdisciplinary group sitting within the Swedish Institute for Global Health Transformation and the university network we have there. And we focused on children in the context of climate change when we developed this paper. And with this huge challenge, we wanted to focus on nutrition and also try to make some concrete suggestions, because it's so easy to talk only about the huge challenges. And also with time limitation, word limitations, you never get down to the more concrete things. So, but we wanted to do that. And we argue that stronger efforts are needed really to safeguard the nutrition of children, and specifically school-age children in this paper that we wrote. And in terms of child health, we all know that the first 5 years of children's lives have, over the past 5 decades, been most in focus. And it's also been demonstrated in the significant investments and also advances in health and nutrition that we've seen for infants and toddlers. We have seen significant improvements in children's health overall, but they have not been for all, everywhere, of course, nor equally. And we have inequalities remaining globally, regionally, but also within countries. And for school-age children, undernutrition is really a critical challenge, particularly in resource-poor settings. And we argue that it's an increasingly critical and urgent challenge as a result of climate change. And it's expected to have multiple severe consequences on people's access to sufficient, safe, and nutritious food. And in the 2019 Lancet Countdown on Climate Change and Health, we stress that every child alive today is affected by climate change, and the way that we respond determines what the world we live in today will look like tomorrow. And there we have a collective and individual response to shape the health of children across the globe throughout their lives. That's the way I would like to see it. And currently it's estimated that 1 billion children actually live in countries at extreme risk from the effects of climate change. Because of the negative effects on food security, undernutrition, including micronutrient deficiency, is identified as one of the biggest threats to child health, as said, especially for children in resource-poor settings. And micronutrient deficiency contribute to stunning in an estimated 149 million children globally, and the vast majority of those live in Africa and Asia. So in addition to the broader societal interventions that we need, such as climate change mitigation and also strengthening health systems, specific measures at the individual and community level may include some concrete suggestions as micronutrient supplementation or the provision of multi-fortified food at schools or at community level, information about healthy diets that we distribute to children and caregivers through health centers and schools, increasing varied local food production. And we also suggest school programs. We have quite some evidence on success stories in this. And such measures can contribute to positive health and nutrition outcomes for school-age children. For example, just to mention a couple of concrete examples. In literature, we see that weekly iron supplementation for adolescents has been shown to reduce the risk of anemia. Also, nutrition education through school gardens has improved school children's own feeling of nutritional agency. So we argue also that implementing locally produced food in school meals is both a realistic and sustainable option for improving nutrition in school-age children. Of course, we have major difficulties, but we are to aim high, and we have some it might sound quite simple, but it's not, of course. And while highlighting a focus on school-age children, we also emphasize that current global inequalities resulting from the negative effects of climate change point us really to the urgent need to transform and adapt food systems from the global to the local level. So we actually can come to a point where we can ensure nutritious diets for children. And we also know that children are one of the most vulnerable groups talking about climate change and exposed to health impacts of climate variability and change. And we have seen an increasing number of studies on climate change and child health that's been published in recent years. But there are major weaknesses and gaps. And for example, we have few studies from low-income countries. And there is also a lack of studies on child nutrition more broadly that is related to climate change. Longitudinal studies are needed. And also in published research, we see that study designs and outcome measures vary so much that it's difficult or even impossible to draw conclusions. So the deficit in research evidence on the impact of climate change and the impact on food insecurity and school children's health and nutrition in low and middle income countries must be urgently addressed and adequately funded. So just to conclude, that in order to safeguard investments that we made in infants and preschool children, and under an increasing pressure of climate change, the health and nutritional needs of school-age children, and the majority of whom live in low and middle income countries, must be given greater priority, both in research, policies, and programming. Thank you.
Maria, thank you very much for that summary. I don't think anybody would disagree with what you said. And clearly these issues with child health, with nutrition and welfare have been with us for decades. And there was some progress, but unfortunately with climate change and the pandemic, it's made everything more difficult, and we expect as worsened outcomes. I mean, some of those interventions that you mentioned, yes, there's research to be done, but some of them we've known about for a number of years. What's stopping that established research, that established knowledge getting into practice and being prioritized by policymakers?
I think one of the reasons may be that it's been quite dependent on aid. And I would like to see that we also had a different type of financing, so it could also be more I mean, people locally could also drive this, because if it's depending on aid, it could be a quite difficult problem.
Okay, so you're saying because of the way donor agendas are driven, that isn't necessarily for the best interests of children in low and middle income countries. I think that's your point.
Not always.
Okay.
Of course,
yes, of
we've
course,
seen
not
some
everybody,
really good
but
results, but we
yeah.
would also need others to take responsibility of the funding.
Yeah. Okay. Thanks, Maria. We'll talk to you again soon. Kent, I'm hoping you're there. I'm hoping you've fixed your connectivity problems, and we look forward to hearing you.
Well, I'm afraid I can't fix it. So I'm in a guest house in Nairobi, but we
can
do
hear
have
you
a fallback.
now, Kent. No, we can hear you and we can see you. Great.
Okay. Well, it seems like, well, first of all, let me just thank PMAC and the BMJ for providing this platform. And Kamran, it sounds like we need to have a follow-up on the how. How do we get these agendas into practice? And I think that this that it's all probably very political. I also, next slide, want to thank my authors. It was a great journey of co-learning, and I want in particular single out Professor Goran Thompson from the Karolinska Institute, who really instigated the partnership that we had on this paper. And Kamran, I want to come back to you, Dr. Abbasi, I should say, editor-in-chief of the BMJ, and congratulate you on your new role, and to say that I think this webinar is a good illustration of the vision you have. And the vision is really aligned with what George is trying to do, the George Institute for Global Health, in relation to you're giving more oxygen in the journal to addressing the structural drivers of health inequalities, and the fact that health is a political choice, and figuring out how to pivot our agenda forward. So thank you for that, and bravo. Okay, so on to our paper. We have 4 points of departure, and it's not time for that slide yet, but since you have it there, that's fine. So we have 4 points of departure, and one of them is that even though we're a diverse, multi-disciplinary group of authors from all over the world, UN and academia, government, we all very much embrace the central tenet of the Sustainable Development Goals on the integrated nature of that agenda, the interdependent nature of the goals, that they are mutually reinforcing, but they are also dependent on one another. Progress on one depends very much on progress on another. And so following from that logic, we see the value and indeed the necessity in collaborating on shared goals. So while there are distinct goals for health and environment, the goals and the ways of achieving them are overlapping in many instances in practice. Think of the health and environmental impacts of active transport, of healthy food, of clean air. So the second starting point, and following on from a point that Fran made, is that we really need a strong government to protect the health of people and planet. And hence there is a need for governance and coordination and action across sectors. So there's a need for intersectoral action for the health of people and planet. And that is the title of our paper. The third starting point, and that's where this slide is in fact germane, is that there's a wealth of experience and analysis of ISA, of intersectoral action. And on health, we've seen that in the literature on the social determinants of health, or on health and all policies. And one of the panelists, not me, is an expert in these things, and that's Professor Fran Baum. But there's similarly a literature from a range of disciplines and sectors on intersectoral action. And for our paper, we looked at the fields of health and climate, sustainability, governance, political science, public administration, business, and so on. And that literature, if you know, there's a lot of convergence across it, that there are a number of barriers and facilitators there, and they use different terms and so on. But it's those 7 that you see on the screen there, or that's one way of cutting up the pie. And I'm not going to read them out. Instead, I'm going to go to our 4th starting point for the paper. And if you look at that literature and the experience, is that the barriers are really winning out. Even though we know what the facilitators are, it's the barriers that win. And it goes back to that question of how, you know, we know what to do, but how do we do it? And so our short analysis is really helping people to think more politically about those barriers and about those facilitators. How do you enable the facilitators, and how do you unblock the barriers if you think more politically? And we used a very simple framework of ideas, institutions, and interests from political science. And so slide 4 then, and so in addition to an argument to be thinking more politically about ISA for health and planet, and thinking a lot more about prevention, and therefore addressing the social and structural determinants of health in the context of ISA, we made 5 recommendations, and they're there on the screen. And I don't know if we can come back to them in our discussion, which I'm doing on time either with my jet lag. But first of all, we need to pay more attention to framing, and that we need to develop visions that transcend sectors and transcend goals. We need to open our mindsets, and we need more compelling narratives that will mobilize the public and politicians alike. At a technical level, I think we need clearer divisions of labor in terms of which ministries lead on which particular issues, and a much more systematic approach to that. The 3rd set of recommendations we make is around localizing global agendas and legislating at the national level for a lot of these things, because it's the only way that you're going to get accountability. But the 4th recommendation is that you can only really have accountability, any meaningful kind of accountability, is if you have systematic and independent monitoring in which civil society plays a big role. Like Fran and like some of the other panelists, we talk about the fact that not any of this how business will work if we don't mobilize civil society. And then finally, we make a recommendation to tie this quite sort of technical, in a way, project to ongoing political processes like the monitoring of the SDGs. We conclude on an optimistic note, so in maybe contrast to one of our panelists. We're optimistic because of the dynamism that the young climate movement brings, and we think hopefully through collaboration that we can repoliticize health. And I know the People's Health Movement is very political, and there are political movements within the health sphere, but we hope that the climate activists will reactivate health. And we also are optimistic because we see divisions in the commercial sector and some investors getting with the program and wanting to invest in well-being economies. And so we end on an optimistic note. And I think in reflecting on our paper, which I was doing, is that we probably need to move from this sort of overview of it to more systematic guidance, concrete guidance on how do you actually think politically in specific situations within these sectors where collaboration needs to take place. So that is our paper in a nutshell.
Ken, thank you. We wouldn't have noticed that you've just got off an aeroplane, so much appreciated. And thank you for your kind welcome. You know, we're here we want to help create this better world, and we think it has to focus on prioritizing outcomes related to health and well-being, and everything that encompasses, not just health, but also the other sectors. So I think your paper is very, very important to what we're trying to achieve at the BMJ. I mean, you talked about the political element of this, and I think you framed it very clearly, although of course, as we know, these are arguments that you and others have been trying to make for a number of years. And then politicians don't seem to be particularly receptive. I mean, how do we change the political mindset, or do we need to change, or are we going to rely on young people to change politics?
Okay, well, we could open up the conversation because two of my co-authors are in fact in the audience, and if they want to jump in, I don't know if we have the technical ability to do that, but I think it's very much, and Fran alluded to this, it's about civic mobilization, it's about activism, it's developing political incentives to basically say that the status quo is not acceptable. And so that's why I'm suggesting that we link this to other social movements. But like Fran said, we do, as you know, I do a fair amount of work on gender in global health organizations, and there isn't really enough traction and in that space. And so we take the view, we're starting to take the view that we've seen HIV activists claim the room. We saw the disability rights movement coin the slogan, "Nothing about us without us." We see young people demanding a place at the table in relation to climate justice. And I think that the health sector just needs to be more political, more vocal. It needs to, and it has been in the past. And somehow I think schools of public health have been training people to be technocrats instead of political activists. And I think they probably need to do both. Over with that provocative thought.
Very good, Ken. Thank you. I'm afraid I don't think we can bring in your colleagues as much as we'd like to. And I'm going to, we're going to move on to the next part of the session, which is taking in questions from our audience today. And I'm going to bring in Lalitha, my colleague from the BMJ. Lalitha, you've been monitoring questions from the panel, questions to the panel, I should say. Would you like to take us through them?
Sure, yeah, there's quite a few that have come in, and Fran has been doing an excellent job by answering some of them, but I might actually ask some of those that have been answered by her in case anyone else on the panel wants to jump in. So we have a question from Zarni. I was a rapporteur at PMAC 2022, and I was encouraged by the discussion in Health System in 2030 session. Following up on that discussion, with ongoing conflicts in Ukraine, Afghanistan, and my home country, Myanmar, we need to pay bigger attention to health as a bridge for peace. My question is, how can social behavior in policymaking push the health as a bridge for peace forward?
Thanks, Lalitha. A big question to begin with. Who'd like to try that? Anybody brave enough? I think Fran's brave enough to answer that.
I have a go. Oh,
yeah, we can hear you now, Fran.
Yeah, great. I'll have a go. Well, I mean, I really wanted to ask the person asking the question to say a bit more about how they saw that would happen. But I do think if you've got a population with a universal public health system that's working really well, then probably people, are going to feel more content, more secure. It gives them security. So I can see that link to health. But I'm not quite sure in those countries under conflict how the health is a route to peace, and I was sort of really putting it back on the question I might like to put in the chat about how they saw that happening, because it's an interesting concept, and I can only think that it works if you provide really good health services for a population. Then that probably says a lot about the society anyway. People will feel more secure and therefore less likely to engage in conflictual behaviour. But that may be a bit of an inadequate response. But it's
no. I think it's I think it's a good response. Unless anybody else wants to answer, I think we've got involved ourselves as the BMJ in these peacekeeping maneuvers. I can remember about 20 years ago, we published a theme issue on health in South Asia at a time where India and Pakistan were having a conflict. A war was taking place, a conventional one at the time. And health professionals on both sides of the border saw that through talking about health, through uniting around improving people's health. It was a way of bringing people together, getting people talking, working together for a better society when our politicians were trying to fight and have a conflict. So yeah, I think there is that general theme, and I hope that's one way that health can have an impact. Okay, thank you. It's a difficult question with not an easy answer. Lalitha, give us another one.
Yes, this is from an anonymous attendee, and Fran, thanks for also popping in your answer on the chat in the Q&A box. The question is, I have a question about how we can tackle climate and pandemic while the geopolitical involvement seems to be increasing. With the Ukraine crisis, it shows how country interest seems to be shifting. Needs to produce more energy by burning fossil nationally, nuclear energy, border measure, and cross-national communication.
Okay, I'm going to say this is related to consumption, use of energy. Ron. Sorry to put you on the spot.
Yeah, well, I mean, but it's a kind of almost a repetition, which is that in fact, unless there's incredible amount of pressure on governments not to do that. I mean, it has been very frustrating in the last few weeks to basically see after the Russian invasion of Ukraine, how quickly governments that made inferior commitments at COP26 pivoted right back to national energy independence, aka fossil fuel dependency, in much the same way that the wealthy countries that could hoarded all of the vaccines. So the nationalistic self-interest is again short-sighting. One of the problems we have is electoral cycles and the way in which the kind of election interests on the part of those in power tend to define what their short-term objectives will be, what becomes popular, what they think will kind of assist them in terms of a re-election, which is why we're moving very, very rapidly into eliminating the last of the pandemic public health measures, because we have a lot of governments facing re-election that want to do that. So I mean, you know, yours is one. We have a province. I'm in Ontario. We have another one, a Conservative government that is entering an election in a few months' time, and it's just joined around the world say, oh, no more mask requirements, none of this kind of stuff. They're all going to be gone in a couple of weeks. So, and that's political. It's pretty obvious. So unless there's opposition, unless there's citizen opposition to these maneuvers, it's going to continue. But I'll go back to my other point, which is that the crises that short-term kind of behavior on the part of politicians, the crises that are going to unfold as a consequence of that is going to come and slam them right back in the face. Eventually, they're not going to be able to avoid really radical transformations. The question is that a bit like the Russian invasion of Ukraine, who are all the bystanders who are going to suffer in the consequences of waiting for that moment to come?
Yeah,
that's what's disturbing.
Yeah. Okay, Ron, thank you. Ken, I think you've got a quick suggestion here.
Well, I mean, I totally agree with Ron that in the United States you have 1% of the top 1% of the wealth of people with wealth. So it's 0.1% make 40% of the political campaign contributions. So 0.1%. So the 1% of the top 1%, they're making 40% of the political campaign. So from that perspective, it is a tough one. And I'm wondering about the investor community, though. Can the investor community, and therefore us as people, some of us have pensions, us making our choices that we make in terms of what we buy, investor activism or investor shareholder activism, to keep the politicians' heels to the fire around those COP commitments that weren't even good enough, quite frankly. But we can't let them get away with the short-termism that Ron referred to around this conflict to deviate away from that. We're in a world of crises. Crises are going to come continuously. And so that's all I want to say on that one. Over.
Good, thank you. And I know Ron has some of this in his article, Ron, don't you?
Yeah, I wanted to make one follow-up point on that, which is I agree with Kent that institutional investors have the capacity or the ability to actually choose their investments in a much more kind of ethical way, because generally speaking, institutional investors are investing on behalf of the public. They may be privately run now because we've outsourced them from what had been public pension funds, but they're still kind of their accumulation is for a public redistribution. Yeah. What I'm concerned about is the move that basically sort of says, let's take all these wealthy private investors, these equity fund people, and so on and so forth, and encourage them to invest in businesses appropriate or supporting the sustainable development goals. But that leaves unanswered. Why did they become so rich in the first place? Where did that capital come from? Who was hurt in the process of that accumulation? And what do you do about the fact that they're still there to make a profit and save the world? But that making that profit is still going to increase wealth inequalities as a consequence, because it's only a very minor elite that have the capacity to engage in that kind of ethical investing. So that's a bigger problematic.
Yeah, I mean, you're saying, I mean, governments and institutions need to take responsibility rather than passing the buck essentially to individuals who got very rich through means that not everybody would be very comfortable with. Okay, Lalitha, we'll take one more question, then I'll go around the panel for final input.
Sure. Question that's come in: how is the US electoral landscape relevant for global health issues? In terms of sheer number of people affected, shouldn't we put the focus on India's BJP or China's Communist Party?
Okay, good question. I'm going to open this up a little bit because I want to bring in Maria and I want to bring in Ankana. How do we, act globally in this way? I mean, rather than finding one international scapegoat, how do we persuade governments to act more broadly? Maria.
Well, that's the $1 million question, isn't it? It is.
Yeah. Do you have $1 million answer?
No, I'm sorry, I don't have that. But I mean, I think as also has been addressed during this seminar, we really need to join forces with all the ones that we have, and I said also include the civil society actions in this that we do. I mean, it's such a huge question. So I think it's a bit difficult to answer easily.
Okay, no, I agree. But I think your point about civil society is a good one. I think Ankana, I mean, civil society is very strong in Thailand.
Yeah.
How can we use civil society to achieve change, Ankana?
Yeah, I would like to answer this question as one principle in Thailand that we also always uses to deal with the difficult situation. We call it triangle that move the mountain. Actually, yes. When we want to change something or dealing with the difficult situation, we don't think that only one sector can do it alone. So it's like a three sector have to synergize their power, the government and the academia, and also the civil society. And I think three sectors should engage and involve in something and move something that big and difficult and challenging.
Okay, well, I think that's a slogan for the day. I'm taking that. 3 sectors can move a mountain. Thank you for that, Ankana. I'm going to go around the panel for final comments. You've got about a minute each. Under a minute would be appreciated. What's your main takeaway from the session today? I'm going to start with Fran. I'll go back in the order that you spoke. I'll go in that order. Fran.
Right. Thanks, Kamran. Well, from the point of view of my comments, the SDGs are really a modest ambition, but they are achievable. And what I take out of today is that, yes, we need state action. States can be great at regulating, but we need a nutcracker effect where you have the top-down state action and the bottom-up civil society action, that you can really crack this nut of getting to a more equitable world. So that would be my point. We do need states that are strong and democratic, and we need a civil society that really pushes them to be that.
Great. I wonder how long we keep these metaphors going. 3 sectors to move a mountain, the nutcracker action of political change. Okay, Ron, the challenge is laid at your door.
Yes, I think that I would just go back and sort of say that the kind of model that the heterodox economists like Mazzucato and others are coming up with, which is a sort of an enhanced neo-Keynesian state intervention, but that assumes that the states are democratic and participatory. But that kind of a model, I think, is a base for which we have to really confront the fact that we have to transform out of the system we've been living with for 300 or 400 years, which is built upon rapid, continuous accumulation, continuous consumption, continuous growth through material throughput. We cannot survive if we continue to do that. So we have to transform out of that system. And I think the activisms across multiple different kinds of sectors actually are encouraging. They are hopeful.
Great, Ron. Thank you. Maria.
Just to add on something, then also we who work in the health sector, as also Ken talked about, we should raise our voices. And I think we have obligation also to raise our voices to make sure that we don't have lots of disinformation flying around. So to mobilize civil society, to make sure that we raise our voices, and also people in the health sector, we have the knowledge, we have knowledge in behavior change, we are trusted, so we should also engage more. And I also think that talking about health puts a human face on all those big challenges that we face, like climate change. So when we talk about health, it's possible to understand why it's important to us and also why we should engage cross-sectoral.
Maria, thank you very much. Very good. Thanks. Ankana.
Yeah, I think I already highlight the point that the synergistic power of the three power.
Yes.
But I just want to highlight more about the community engagement. I think if we discuss at the top level, but it's not digged into the ground, or it's like a implementation in action and engage the community, I don't think that is the right direction. So the second point that I just would like to highlight is about community engagement. It's not only the sector like civil society or government, but it needs to be at the local level. It's like the word SDG localization that the UN try to empower everyone to do this.
Yeah, great. Thanks. And final word with you, Ken.
Yeah, so 2 points. One is I do think we need to reimagine global health, and I think that goes back to the who dominates global health, and that we need a lot more Southern voices in the reimagining, because I think we'll get a much more transformative global health. And so again, I want to just salute the BMJ Global Health under Shay's leadership, really providing a very good conversation for that. And the second point, and just I come back to this sort of the how, that we can have these agendas, but we really need to think more about the how. And so I'm going to make a plug for co-creation of knowledge between activists and academics and policymakers who are progressive, to co-create knowledge and co-create action. So evidence-informed action that's co-created. Thanks again.
You're welcome. So thank you. I think that's a good note to finish on. I'm very grateful to all our speakers today. They've written absolutely brilliant papers, so I recommend you go and read them. And you can read them on our website, which is bmj.com/PMAC-2022. If that's hard to type into a browser, just Google it. You'll find it. They're all very, very worth reading. I'm grateful for the time our speakers have spent with us today, and the wisdom they've shared with us. Grateful to our colleagues at PMAC for working with us on this collection, and my colleagues at the BMJ for all the hard work in putting this together. I think this is a very important topic. I think that is probably the most important topic, the world we want, the world we need to create. So world, I think, that does have a face that focuses on health and well-being, outcomes, like the word outcomes to that. I think it is a world about social justice. It is a world about equity. And I think together we can work, we can make it happen. So let's be hopeful, let's fight for it. And thank you all for joining us today. Thank you. Goodbye.